Hi, good morning, good afternoon. For those who don't know me, my name is Dr. Heather Stanley-Christian. I am the founder of Unity Maternal Fetal Medicine, and I'm here today to talk to you about formal antenatal testing. And I do apologize. This is the time that they're having construction in the hospital. So, formal antenatal testing, it's a really important part of prenatal care, and it helps us as physicians to monitor the well-being of the baby in terms of its oxygenation. Formal antenatal testing has a range of tests and procedures that are designed to reduce the risk of stillbirth. So we, unfortunately, our ladies have lost about 22,000 babies every year due to stillbirth in the third trimester. So this is something that can really be helpful. The timing and the frequency of the testing depends on what's going on with mom or what's going on with the baby. But it generally starts in the third trimester, usually after 32 weeks. The one method, if you don't remember anything else, the one method I would like for you to know is the fetal kick counts. This is something that every pregnant person should be performing every day. Starting after 28 weeks. So how it works is that you choose a time of the day that you know your baby tends to be active. You'll get an idea after enough times that your baby is very active, just about the time you want to try and sleep, or at some other time, like maybe after a particular snack or a particular meal. And for every day starting 28 weeks, you're going to choose that time of the day. Then you're going to use a timer on your phone, and you're going to record the time it takes for you to feel 10 fetal movements. Usually that shouldn't take more than an hour. If it does, then you'll have to extend that testing for another hour to see if you get the 10. After each day's counting session, you're just going to compare. So I have no shares in this, but Count the Kicks has an app, and you can use that to look at the counts every day. And you're going to compare it with the last few sessions. If you notice that there's a significant drop in the number of movements, or an increase in the amount of time that it takes for the baby to get to 10 movements, then what you're going to do is first, you're going to breathe. You're not going to panic. And you might want to have something a little sweet. If you're diabetics, maybe something, if you haven't eaten, then maybe have a meal. And then you're going to count for the second hour. If you don't feel a total of 10 movements in that second hour, you need to do the following things, please. You're going to call your doctor's or your provider's office. You are not bothering the doctor. Do not doubt yourself. Don't sit down and second guess yourself as to what you just experienced. If you find that you're not being heard, please speak up. We can speak up in a respectful and mindful way, but you need to be heard if this is concerning. If your doctor's office is closed, then you can go to labor and delivery if the office is not open. Labor and delivery is open 24/7. So don't worry about bothering folks. That is our role. That's our mission. That's what we're here for. Okay? It's better to be safe than to be in regret. Okay? So let's say it was a day that your child just decided to see how attentive you were, and the baby didn't pass the fetal kick counts. Then in the labor and delivery, what they do is something called an NST, or a non-stress test. This actually is a machine that has two sensors, And one sensor is to pick up the fetal heart rate rhythm and any changes in the fetal rhythm, and it's charted on the paper for the analysis of the doctors. It usually lasts for about 20 to 30 minutes. The sensors are held onto your tummy by your waist, and you actually can hear the baby's heartbeat, and it's soothing for a lot of moms. If after interpretation of that test, the NST or the non-stress test, oftentimes a biophysical may be done, which is an ultrasound test, but it's not an ultrasound for growth or anything. There are specific parameters that are observed. Sometimes they'll use the ultrasound just to measure the fluid alone in conjunction with the NST. The biophysical profile looks at baby's movements, tone, AFI practice breathing. And if all that is well, then you're going to go back to your daily kick counts. So that's something that I would love for you guys to be aware of. Start after 28 weeks. And that's pretty much it for today's talk. If you have any questions, if you have any concerns, if you feel like you need to reach out to somebody, again, my name is Dr. Heather Stanley-Christian. I may be reached at Unity MFM on Insta. There's a link tree where everything is right there. And I want you to have a wonderful day and walk good. Okay? And don't forget to breathe. Bye.